Did you know that you've got choices? That there can be a better way? Did you know that you've got choices? Call Dr. Leaderman today. 212 choices, a much better way. 212 choices. Call Dr. Leaderman today. Did you know that you've got choices? That there can be a better way? Did you know that you've got choices? Call Dr. Leaderman today.
This is the art of radiosurgery. We were fortunate to be able to display our art of radiosurgery on the biggest boards in Times Square so that as many people as possible could learn about treatment options. We realized that not everyone could be there, and so we've made this video possible and available so you can learn what so many other people have already known about, and that is there's huge difference in cancer treatment. We hope you listen and learn, and if you have cancer questions, come in, make an appointment. Call us at 212 Choices. We accept most insurances, Medicare, Medicaid, if you wish. Otherwise, just sit back and learn. Many times, chemotherapy doctors tell the patient that they failed chemotherapy. But what they really mean is that the chemotherapy failed the patient. That's how they should speak. They should be honest. If chemotherapy fails, they should tell the patient the treatment failed. That makes it more understandable for the patient, and it makes it easier for the patient to make decisions about changing therapy. It's not the patient's fault. It's failure of treatment when chemotherapy doesn't work, or isn't tolerated, or isn't wanted. This is a picture of the Western Hemisphere from the tip of Canada all the way to the tip of South America. When all the other hospitals, cancer doctors, and facilities in the Western Hemisphere offered only standard radiation, one doctor brought to you and your loved ones stereotactic, non-invasive, pinpoint radiosurgery to be able to hit the cancer non-invasively with no cutting and no bleeding and high success rates in general where we attack the cancer. This is the revolution of radiosurgery. This is an illustration of treatment options for patients with cancer. On the right, the red body shows chemotherapy going into the body, and usually chemotherapy is given in the vein, and that means it goes throughout the body from head to toe. Chemotherapy is really a kind of poison. It tries to poison the cancer more than the body. The problem is it's directed to the entire body. That's why chemotherapy often doesn't work, because it's given to the entire body, not just the cancer. That's also why there's side effects, because chemotherapy is going to the entire body, whether it's the bone marrow, the hands, the feet, the kidneys. This is totally different than what you see on the far upper left, radiosurgery, where we attack the cancer precisely without the harm to the whole body. Also on the bottom panels to the right, you see a knife, and we're talking about surgery being an invasive option for the treatment of cancer. Surgery is a mechanical removal of part of one's body to try to help them fight the cancer. Often surgery is deforming, often surgery is difficult, often surgery is unsuccessful. That's why so many people come here for treatment options. In the center panel on the bottom is a little panel about hospice, and some people want no treatment. Hospice means no medical treatment. And then on the far bottom left is standard radiation. Standard radiation radiates healthy tissue, usually over weeks and weeks of treatment, to attack the cancer. The yellow box shows the healthy tissue being irradiated while the radiation tries to get to the cancer. On the top left, radiosurgery is illustrated with a ball of red cancer and the beams going directly to the cancer. And that shows what we do. So it's more precise, more direct, fewer treatments, in general more successful than other methods of treatment. That's why our treatment is so revolutionary. You can see vividly on this piece of art the differences between radiosurgery, surgery, hospice, standard radiation, and radiosurgery. Why do men with prostate cancer choose our treatment? Well, number one, great results. Number two, avoiding radical robotic surgery. Number three, maintaining sexual life. Number four, maintaining urinary control. Number five, avoiding the penis shortening of radical or robotic surgery. Lots of reasons people come here. Our goals of treating prostate cancer. Great results, avoiding surgery, radical or robotic surgery, maintaining sexual life, urinary life, and maintaining the body. This illustrates our weapons in the war against cancer. We're the first in the Western Hemisphere with body radiosurgery, first in New York with brain radiosurgery, data presented at medical meetings, decades of experience, triple board certified, Harvard-trained doctor, ready to fight for you if you wish. Why do women with breast cancer come to radiosurgery in New York for consultation and treatment? Number one, great results. Number two, maintaining one's breast whenever possible. Number three, avoiding hospital treatments. We encourage women with breast cancer to learn about all options. When I first came to New York, 97% of the women with breast cancer in New York were getting mastectomies at the big hospitals. In my practice, at the same time, 90% of women were keeping their breast for breast cancer treatment. It's a big difference. Here's New York City. When every hospital, facility, and doctor in New York offered only standard radiation, one physician offered a better treatment, radiosurgery for many cancers. This woman came to Dr. Leaderman with a swollen right hand. That's all that she knew. She had been at another hospital a couple of weeks before, and no one made a diagnosis. In fact, apparently no one even examined the patient, even though she was a hospitalized patient. She came with a swollen right hand. You can see it in the upper left corner. Dr. Leaderman found a massive destructive breast cancer involving the entire former right breast, involving the lymph nodes under her arm. Immediately, she had a painless biopsy and a PET scan, all in the same morning, to confirm the diagnosis and the stage. Following Dr. Leaderman's short course of outpatient therapy, there's been total resolution of her cancer. The nipple and breast are reappearing. Her hand and arm swelling, which was so difficult before, have resolved with no cutting, no bleeding, no hospitals, no surgery, no ICUs, no ventilators. This patient is very, very happy. Our staff and doctors, too. This is the work we do at Radiosurgery New York.
You know that you've got choices, that there can be a better way. Did you know that you've got choices?
We believe that cancer treatment should be toxic to your cancer, not your body. That's what radiosurgery is all about, trying to minimize toxicity whenever possible. Breast cancer treatment is easy here at Radiosurgery New York. You can see a patient undergoing treatment. This is actually a model illustrating what a patient would be doing during breast cancer treatment here. Our treatment is painless, non-invasive, outpatient, well-tolerated. There's no cutting, no bleeding. The treatment's performed in minutes. We have lots of information to send you about breast cancer if you wish. We have a long track record treating skin cancers with no surgery, no Mohs, no radical surgery, no excavation of your skin or body. Our treatment for skin cancer has high success rates, over 90%, with no cutting and bleeding. It's appealing to many people with skin cancers. We treat many basal cell cancers and squamous carcinoma over years. We're the first physician to report cardiac toxicity from standard radiation. Standard radiation often hits healthy tissue. By introducing radiosurgery first in America, first in the Western Hemisphere, we're able to minimize or avoid the toxicity of standard radiation. Many people are concerned about cardiac toxicity. We're the first to describe it, to write about it. This is our work. This is our interest. This is what we do for our patients every day. This is an illustration of some of our staff, all wearing shirts showing their faces twice. Our staff is great. Our staff is here to serve you. For newer recurrent cancers, even if prior chemo, surgery, or radiation didn't work or isn't wanted, please think about giving us a call or getting our information. Call us at 212-CHOICES. That's 212-246-4237. 40 years of physician, 40 years being an MD. Happy anniversary, Dr. Leaderman. Many of the big hospitals say they're going to take care of cancer in their lifetime. We try to take care of you and your cancer in your lifetime. What do you prefer? We believe we know.
You know that you've got choices, that there can be a better way. Did you know that you've got choices? Call Dr. Leaderman.
The big hospitals spend millions of dollars in fantasy advertising to create an image we think they feel they must. We offer to treat the patient as we would want to be treated ourselves. That's our tradition. That's what we do. That's what we offer. We talk about all the options for every patient who comes here, including even no treatment, if that's what you wish. Many cancer doctors advise patients to have the treatment that they administer, rather than to inform the patient about all the options. It seems like they're blinded to innovative treatments like radiosurgery. We believe that many people with cancer never get a fair chance to learn about all the cancer treatment options until they meet Dr. Leaderman at 1384 Broadway. We believe that all cancer patients, all people with cancer, should be told about all treatment options. We believe that educated patients can choose the most appealing, beneficial treatment for themselves. Grandma used to teach, measured twice and cut once if she was a tailor or sewer. We teach you should learn the data first, the first thing you should do before making a treatment decision. Then there's less chance of having regrets. We talk about brain radiosurgery versus non-invasive radiosurgery for brain tumors, cancers of the brain, and benign tumors. We treat cancers like cancers that spread to the brain, cancers that start in the brain like glioblastomas, and benign brain tumors. For example, pituitary tumors, and meningiomas, and acoustic neuromas. We have excellent data over 30 years. We're first in New York with brain radiosurgery, first in New York with fractionated brain radiosurgery. Decades of experience, here for you. Radiosurgery New York, Dr. Leaderman, we're the home of finding solutions to complex medical problems. This is what we do every day. Our secret weapon in the war on cancer. New ideas, new thoughts, new treatments, non-invasive, here for you.
You know that you've got choices, that there can be a better way. Did you know that you've got choices? Call Dr. Leaderman today.
When we meet our patients, we like to sit down. My grandfather, 55 years ago, told me when he went to his doctor, it's best to close the door to his doctor, close the door, sit down, and stay a while. And that's what we try to do with every patient, give them privacy and time to ask all questions. When everyone benefits delivering cancer treatment but the patient, it's probably time to meet Dr. Leaderman. We believe the wise patient chooses the best treatment first. That's why so many people come here first, either with a suspicion of cancer or when diagnosed first with cancer. When your health is at stake, you're probably wishing to have Dr. Leaderman in your driver's seat. Avoid the slow pokes. So often we see patients waiting weeks and months and even longer for cancer treatment. This shows the first patients treated in the Western Hemisphere with radiosurgery. It was a woman who was given up to die. She had a lung cancer. She had chemo and radiation and surgery at one of the biggest hospitals. It didn't work. She was sent home to die. She came to us decades ago. And you can see the top slide, how the cancer was growing next to the heart and through the ribs. And after our treatment, remission. She and her family were so happy. So were we. The first patient treated in the Western Hemisphere with Dr. Leaderman. This is my chief from Harvard. He used to say, when asked about a patient who would take useless cancer treatment, it's like a man who fell out of the Empire State Building at the 50th floor. He would respond, so far, so good. Well, so far, so good is not enough for our patients. We suggest knowing the facts before starting cancer treatment and choosing the best cancer treatment first. We encourage patients not to take treatment that have poor results whenever possible. When your health is at stake, avoid the slow pokes. We run rings around the slow pokes. If you feel like you're not getting the attention you need, if you're lingering, if you're not getting care, give us a call. Most likely you'll be very pleased with the pace of diagnosis and offering treatment here at Radiosurgery New York. There are huge differences in the treatment of prostate cancer. Huge differences with results, huge differences with treatment techniques, huge differences with outcomes, sexual function, urinary function, and even maintaining one's body anatomy. There's huge differences. It's always best to meet in person. We're proud, of course, to be the first to offer and deliver for you and your loved ones in the Western Hemisphere, stereotactic body radiosurgery. We're here for you with the most experienced body radiosurgery physician in the Western Hemisphere. We know that when patients ask doctors who we should go to, most every doctor will tell you, go to the most experienced physician in the field. There's big differences between surgery and radiosurgery. With surgery, you probably go to the hospital packing your suitcase with toothbrushes and slippers and your pajamas, and then eventually you go home with your surgical supplies. At Radiosurgery New York, you can come with one little Metro card. Come here, get a treatment. Usually treatments last a few minutes. We're here from early in the morning till late in the evening. Here for you. Treatments usually take about 15, 20 minutes. You come in, get a treatment, and most likely go home or go to work. It's a huge difference between open surgery and our non-invasive stereotactic body radiosurgery. This is the front cover of our new breast cancer treatment booklet. Breast cancer treatment is easy with Dr. Leaderman. It's painless, non-invasive, outpatient, well-tolerated. There's no cutting, no bleeding. It's performed in minutes with no hospitals, no ICUs, no ventilators. This is the work we do, and you'll see many, many examples when you read through our breast cancer booklet. You'll see examples and read about women from all over the world who come with small breast cancers and large cancers of the breast. This is the work that we do. Many women come to us not wishing to have surgery and not wishing to have chemotherapy, and we certainly have a unique program to accommodate almost all women with breast cancer. When Dr. Leaderman came to New York, 97% of the women in New York were receiving mastectomies, losing their breast for breast cancer treatment. In Dr. Leaderman's practice, at the same time, 90% of women kept their breast even with the diagnosis of breast cancer. The exact opposite. It's a big choice. It's why so many women with breast cancer come to Radiosurgery New York for a fresh second opinion about breast cancer and many other cancers. the first doctor in New York to perform stereotactic brain non-invasive radiosurgery for brain tumors and brain cancers, is pictured here. Decades ago, Dr. Leaderman, along with politician Mark Green and Mary Furman, demonstrate the first brain radiosurgery decades ago. First with Dr. Leaderman, the most experienced doctor performing non-invasive brain radiosurgery, no cutting, no bleeding, no hospitals, for benign brain tumors like meningiomas and acoustic neuromas and pituitary tumors, as well as for cancers of the brain like metastasis, cancers that travel to the brain, and primary brain cancers like glioblastomas and astrocytomas. The most experienced doctor with brain radiosurgery, first in New York, when all the other hospitals and facilities and doctors thought standard treatment was okay, one doctor brought to you a better approach. Our treatment is concoction-free. Concoctions don't cure cancer. Come and talk to us if you wonder about best treatment options for your cancer or that of a loved one or friend. This is Blondie and her lung cancer. This is a woman who came to us with a huge lung cancer. You can see it on top. She came refusing surgery, refusing chemotherapy, wanting radiosurgery only. She had been seen at some of the biggest hospitals and the biggest surgeons and chemotherapy doctors. She wished to have our treatment only. We treated her years ago, and this big cancer mass and the pain and the difficulty she was experiencing have all gone away with our treatment only, no surgery, no chemo. She's now in remission for many, many years, and she's very happy about the treatment and the results at Radiosurgery New York. We aim to fulfill our patient's single wish, to get better. This shows a PET scan of a patient who went to one of the super duper hospitals in New York. She was given chemotherapy for pancreas cancer. As a young woman, athletic woman, wanting to live, of course. The chemo didn't work. And the cancer wrapped around the duodenum, and she was losing hope, maybe lost most all hope. The big super duper place had no options for her. She came here, met with me. We talked about all the options, chose our treatment, and now, years later, is in remission from her progressive, unresectable pancreas cancer. Just one example of our work here at Radiosurgery New York. If your cancer treatment isn't working, isn't wanted, isn't tolerated, getting a fresh second opinion with Dr. Leaderman is not bigamy. It's smart. It's smart to see Dr. Leaderman for a newly diagnosed cancer, or to come here when other treatments, chemo, surgery, or radiation doesn't work, isn't wanted. It's not bigamy to get a fresh second opinion. This illustrates what happens to different patients with kidney cancer. On the left, the kidney in a bucket. After the surgery, the kidney is put in a bucket and sent to the pathology lab. The patient will never have that kidney again. On the right is the picture in the center of a kidney cancer, and on the far right is that same kidney after our treatment with no cutting, no bleeding, and now no cancer 10 years later. This is the work we do. It's why so many people with kidney cancer come to Dr. Leaderman. We're sorry for all the surgery that's no longer needed. We're here to try to replace treatment that's not very desirable, whether it's surgery or chemo or standard radiation. You may wish to give us a call, or better yet, to learn all details, come for consultation to learn about all the options by the most experienced radiosurgery body doctor in the Western Hemisphere. Moonwalkers return to the earth with a different view of life, like people with cancer, successfully treated. What's the difference between standard radiation and radiosurgery? We're often asked. Think about a plum in a bread box. Standard radiation often treats lots of one's healthy body, like the bread box, whereas we're able to treat just the area of the cancer in general. It's a huge difference.
You know that you've got choices, that there can be a better way. Did you know that you've got choices? Call Dr. Leaderman today.
Unparalleled design, unparalleled art, unparalleled music, unparalleled cancer treatment experience. For squamous carcinomas of the skin, basal carcinomas of the skin, patients like, in general, our treatment. No cutting, no bleeding, no Mohs, radical deforming surgery. This is the work we do with decades of experience, high success rates. We have lots of information to send you as well. We say, vote for you. Vote for you. Think about you, what's best for you, and your options to treat cancer. Vote for you. Vote for you means choose your benefits. Don't think about the hospital, the doctor, the laboratory. Think about what's best for you and the track record for you and how your life will be and the chance of success with cancer treatment for you. It's said the Great Wall of China can be seen from space, but our thousands of beams of radiosurgery that attack cancer are always invisible. Cancer has one job, that's to grow. We have the opposite job, to stop the cancer, to make it go away. That's what we do. Radiosurgery may make sense at any age for many, many reasons. We see young people, middle-aged people. Our oldest patient is more than 100 years old with high success rates where we attack the cancer. Dr. Leaderman on the radio. We're on many radio stations with information every day of the week. We see patients with cancer, take notes, and then come and explain to you so you can better understand what happens to patients with cancer, seen at hospitals around the world and in New York and elsewhere, and then what happens with treatment here if the patient wants. That's what we discuss every day on the radio. Doing the right thing every day at Radiosurgery New York, whenever possible, makes us Tranquility Base, maybe Tranquility Base number 2. Wouldn't the world be a more beautiful place if everything was custom tailored like Dr. Leaderman's stereotactic radiosurgery for cancer treatment? First in America with body radiosurgery. We're sorry for all the standard radiation and chemo and surgery that's no longer needed. We're not sorry, however, to be America's radiosurgery pioneer. First in America with body radiosurgery. You're the Supreme Court Justice of your body. You should make your verdict knowing all the facts. That's what we try to provide for every patient here at Dr. Leaderman's Radiosurgery New York. We're meeting people with cancer and on the radio every day to give you a head start against cancer and to learn about all treatment options, often seemingly hidden elsewhere. This is an example of cancer eating through the bone. On the far left, you see a massive cancer eating through the bone. It looks like a rat is eating through a spine. On the far right, you see the same spine that was eaten through by cancer, now treated with radiosurgery. The cancer's gone, the bone is healed, the patient is happy. The patient is happy with our treatment. Other treatments didn't work. Our treatment has a high success rate, even for cancers in the bone. Dr. Leaderman believes you are the President of the United States of your body. Seems like most everyone agrees and likes to wear Dr. Leaderman's presidential button. These are photographs of a woman from Connecticut who came with a vicious cancer of her hand, of her finger. She saw multiple surgeons at 3 of the most famous hospitals in New York. Every surgeon told her she must have partial hand amputation. No doctor and no hospital offered her any other option until she met Dr. Leaderman. Here on the left, you see a massive cancer starting in the skin, starting in the front, eating its way through the back and through the bone. This woman adamantly refused the advice of multiple of the most famous surgeons and specialists at 3 of New York's most famous super duper pooper scooper hospitals. She sought consultation with Dr. Leaderman. She trusted him and his decades of experience with thousands of cancer patients treated. Today, her cancer, seen on the right, is in remission. There's no evidence of residual cancer. She's about the happiest person in the world, and so are we to have offered her our cancer treatment services and experience and expertise. Choosing local convenience for cancer care over our decades of experience and leadership is possibly a dangerous compromise for your health. Beware. There's many reasons men prefer our prostate cancer treatment. Radiosurgery is very dangerous to the treated cancer. 2 men met on the Trans-Siberian Railroad, traveling for days. One was talking about prostate cancer. The other one told him, better see Dr. Leaderman. And today he came. A true story started on the Trans-Siberian Railroad. Something everyone can agree on, Dr. Leaderman's first in America with body radiosurgery. Radiosurgery is directed to attack the cancer. Friends deter friends from radical surgery. There are often non-invasive medical choices, best learned here at Radiosurgery New York. Don't be mesmerized by a facility. Be mesmerized by getting the best results, the best quality of life, avoiding radical surgery whenever possible. Get the best results. Let's be responsible for your radiosurgery. We believe you are the President of the United States of your body. That means you, not your chemo doctor, not your surgeon, you. You get to choose all options. When every hospital and every facility and every doctor in the Western Hemisphere offered only standard radiation, one doctor had a better idea. Guess who? If you have prostate cancer, would you prefer a 90% success rate here or 60% at a famous hospital? Isn't learning the actual data great? Don't you understand why every patient with cancer should come for consultation? That's why it's so important to spend the time and effort. Call us, 212 Choices. Come and learn. You'll probably learn a lot about your body that you never knew before. We aim to fulfill our patient's single wish to get better. This is Dr. Ariel Leaderman, excellent cancer doctor, warm and compassionate, caring doctor, here for you. He's beloved by his patients, the staff. He answers the questions. He's well-trained, talented, and might be the perfect choice for your cancer doctor. Highly recommended by all. There's huge differences between standard radiation, which is given at most facilities, and stereotactic body radiosurgery, pioneered first in the Western Hemisphere by Dr. Leaderman. Today I saw my patient, a 90-year-old man whose prostate cancer we treated more than 20 years ago. His PSA had been 0 for 2 decades. Complete remission, fully functional. Some people call this a cure. We call it another bullseye. Wouldn't it be great if food cured cancer? Sad to say it doesn't. Best is to meet Dr. Leaderman about cancer treatment best for you and your loved ones. When uncertainty filled the world, we've been treating people with cancer without exception, without interruption, without hesitation, without question, every day. We've been here every day for our patients. It's the Leaderman Radiosurgery team here for you every day. What a difference. We treat cancer. We hit the bullseye. We hit the cancer for you. A rare quality. We listen. It's hard to believe that the radiosurgery district was once known in the past as New York's fashion district. Health and happiness, that's why we're here. Health and happiness, that's our wish for you. Here's Dr. Ariel Lederman. Here for you, Dr. Lederman's radiosurgery team, first in America, here for you every day with innovative cancer treatment. Dr. Lederman suggests avoiding treatments that don't work. Be suspicious of unproven remedies. Stick with a winner. These experienced hands have placed 500,000 radiation seeds, one by one, into the prostate cancers of thousands of men. Learn how this technology and this experience might benefit you, your loved one, your neighbor, your friend, or the man down the street who needs care. We believe that men with prostate cancer have 5 wishes. Number 1, getting the best cancer-free survival. Number 2, avoiding radical and robotic prostate cancer surgery. Number 3, maintaining sexual function. Number 4, maintaining urinary control. Number 5, avoiding surgery and robotic surgeries, penis shortening, and alteration of one's body. There's lots of reasons. 1, 2, 3, 4, 5. Reasons to see Dr. Leaderman about prostate cancer.
You know that you've got choices, that there can be a better way. Did you know that you've got choices?
Why was Steve so happy to bring us this cake? Well, Steve was a business executive. His PSA rose from 3 to 4 to 6, and his doctors told him not to worry, nothing to do. And then he got another PSA a few months later, and it was 60. He came here, and his PSA was 90. He was in trouble. He had a very aggressive cancer. We arranged for a biopsy and staging. We found his cancer. We found the extent of his cancer. We started treatment. Despite a long distance, he came from Connecticut for his treatments. And I can tell you that he's very happy today. His PSA is in the 0 range. He's doing well. He has his garden and family and life. And he brought us this cake to enjoy together. Thinking about prostate open surgery or robotic surgery, most men have sexual problems after open or robotic surgery. Most men have urinary problems or leakage. Many men lose length of their penis. Most men want to have, I believe, better results, avoiding radical surgery, maintaining sexual and urinary life whenever possible, and maintaining integrity of one's body. This is why we're here for you. Every day, Dr. Leaderman is on the radio. Every day, radio listeners learn and save lives by informing others. Listeners save lives. Even our website is listenerssavelives.com. Tune in, if you wish, every day. Why is Dr. Leaderman on the radio every day, every week? Simply put, to educate. The First Lady is diagnosed with breast cancer and must have mastectomy, the news media shouted. This was 1987. One physician immediately called the major television networks and the White House to say the diagnosis of breast cancer most commonly does not require mastectomy. The one physician, Dr. Leaderman, of course. When 97% of women with breast cancer had mastectomy at major New York hospitals for breast cancer treatment, 90% of Dr. Leaderman's patients saved their breast, avoiding mastectomy for breast cancer treatment. It's easy to understand why so many women choose Dr. Leaderman for their cancer treatment. For decades. At Dr. Leaderman's radiosurgery, we're lifeguards too. A most beautiful life, one's child following in one's parents' footsteps, exceeding in every way, bringing knowledge and health to his patients, happiness and love at home, an exemplary life. Dr. Ariel Leaderman, MD, here at Radiosurgery New York. Come see him if you wish. Hats off to the president after radiosurgery. Why would a president choose radiosurgery? For the same reasons as you. Non-invasive, highly successful treatment that hits the cancer. When every hospital and doctor thought standard radiation was okay, Dr. Leaderman had a better idea. First and most experienced in America with body radiosurgery. You too can have presidential treatment with Dr. Leaderman. Best wishes to the president. Thank you for watching this video about our art of radiosurgery. As you've learned, radiosurgery is very different cancer treatment than usual chemo and radiation and surgery for most cancers, for brain cancers, body cancers, lung, breast, liver, pancreas, kidney, bladder, prostate, primary cancers, metastatic cancers, and more. You'll see in our booklet probably a list of 100 different kinds of cancers that we treat. Most cancers, common cancers, and rare cancers, we treat with high success rates where we attack the cancer. Best is to meet, review our material. My name is Dr. Leaderman, most always available for you if you wish. Just give us a call, 212-CHOICES. Send an email, gil@rsny.org, gil@rsny.org. And we look forward to meeting with you, if you wish. Thank you, and God bless you.
You know that you've got choices, that there can be a better way. Did you know that you've got choices? Call Dr. Leaderman today. 212 choices, a much better way. 212 choices, call Dr. Leaderman today. Did you know that you've got choices, that there can be a better way? Did you know that you've got choices? Call Dr. Leaderman today. 212 choices, a much better way. 212 choices, call Dr. Leaderman.